Welcome to the 217 podcast, presented by Decatur Earth Mover Credit Union and hosted by me, Jes Younghouse. In the podcast, we're going to talk about the Decatur community and the people that make it great. Thanks for listening and thanks for watching. We hope you enjoy it. Welcome back to the 217 podcast. We have Cindy Bardeleben here, the executive director of Baby Talk. So welcome, Cindy. Thanks for joining us.
Thank you, Jes. It's great to be here.
Let's start with just about you and how you made it to Decatur and where you're from and all that stuff.
Okay. Well, I grew up in Roanoke, Illinois, on a farm, and Roanoke is between Peoria and Bloomington. So I have farm roots.
Okay.
And then went to college at Concordia University in Chicago.
Okay.
And met my husband, and then we both taught.
Okay.
In near St. Louis.
Okay.
So Wood River, Edwardsville area.
Okay.
So we were there about 5 years, and then we moved here for my husband's work because he taught at the LSA. So, of course, I came along and I was pregnant then. And so then we had kids here and 2 kids. And then when our youngest was about a year, I started working for Baby Talk.
Okay. And so you started, though, as a teacher. You started your career as a teacher.
Yeah. So I had early childhood and elementary.
Oh,
That was my, though I'm certified in both early childhood and elementary.
Are you going to be a substitute?
No.
Okay.
Sorry
about the sub shortage, but no.
I subbed a little bit while I was pregnant, and wow, that is a special gift for people to be able. It was way out of. I just didn't have enough control.
Yeah.
Or felt like I was in control.
Sure.
Yeah. So
fair enough.
Yeah. So
it's not for
probably
everybody.
not.
Not for me either.
Probably not. Just being honest.
Okay. So you started at Baby Talk how many years ago?
31.
Yeah.
31. And I started working, and it was 8 hours a week.
Okay.
So my youngest was a year, and oldest was about 4 or 5. So it was 8 hours a week.
And so what was the job that you started doing there?
Okay. Back then, there were prenatal clinics at both hospitals. So that was for underinsured moms who were pregnant, and so for them to receive prenatal care. So I would be kind of in the waiting room there as moms were waiting for their appointment and connect with them, and we'd talk about baby's development. We might make a homemade toy, but really, and then connect to community resources and that kind of thing.
Okay.
And then I started doing newborn encounter visits.
Yeah.
So.
Okay. Everybody kind of knows about that. Once you've had kids, you know what that experience is, because that's still happening today.
It is.
Yeah.
It is, thankfully.
Yeah.
We had to take a little hiatus with COVID.
During COVID, but it's back.
Yeah.
So how long has Baby Talk been around?
36 years.
Okay, so it was still fairly new when you joined.
Right. So we were pretty,
years ago.
Like there were 4 or 5 staff at that point,
Okay.
and I was very part-time.
Okay.
And then when I started working full-time, it was with family literacy, and that program was held at the health department. So Baby Talk really is about being in the community and being in spaces where families already are.
Okay.
And so at the health department, we had a family literacy program, and so that was for parents, moms who were working towards their GED.
Okay.
And so there was GED classes by Richland. And then we would also have child care, child education, parenting, parent-child interaction.
Sure.
And so we were there quite a few years.
Okay.
So this is kind of a fun story, is that my office there when we started out was a cart.
Okay.
It was a cart on wheels, and that I would roll in and out every day. But it was in the women's employee shower stall.
OMG.
A lot of stories.
Yes. Back when employers had shower stalls for employees.
And at the health department, I think that was maybe a required thing for safety and all of that. But
that's funny.
Yeah.
So tell me, just like, we know Baby Talk's been around, you said 37 years. How did it get its start here in Decatur? And how has it evolved, and like what all programs are you guys offering today?
So Claudia Quigg is the founding executive director. And how that started is for her, she was a kindergarten teacher because she really wanted to impact children and families at the very beginning.
Sure.
So she taught kindergarten for a few years and said, oh, we need to start earlier.
Sure.
And one thing that I really appreciate about Baby Talk and Claudia and her vision is that a child's well-being is really about being in families. So thinking about a child within their family and those trusting relationships and supporting that and understanding that every family has strengths. There might be some vulnerabilities. There might be some resources that are in need, but really every family has strengths.
Sure.
And identifying those and building on those. And then of course the early years of brain development and all of that.
Yeah.
So Baby Talk started with Newborn Encounters, and she's the one who pulled a lot of people together and said, okay, really a really wise community collaborator.
Yeah.
And that's been our base, which serves us well today.
Yeah.
As we think about who else in the community cares about families, but then but provide different things. So we're not duplicating.
Right.
So differentiating between that.
So how many families, like, you come and do a newborn encounter, a family's maybe never heard about Baby Talk. I mean, what's the penetration of people that will come back to you having not really known you before? Right.
It's so that when we go to the hospital, I did that for quite a few years, and people will say, "Oh, what a cool job with the babies," and it really is.
Yeah.
It's lovely, but we're really intentional about. Yeah. So we're learning about the family. We have a lot of different goals. We're learning about the family as far as if there's possible resources that we can connect them with, whether from Baby Talk or other. Yeah. But really, we want to encourage the family and help them understand that they have strengths already and that they know their baby better than we do, even as they already do know their baby, even 6 hours old, 12 hours old. They know things about their baby. So really facilitating that relationship is key to that as well. And really having a conversation.
Yeah.
And versus coming in and saying, oh, here's a checklist. Do you have these things in place? Do you have transportation? Do you have a home? Do you? And that would be very, we want to be strength-based.
Like harsh, some harsh reality if that's not always met or able or whatever.
And the last thing that any family deserves is for them to feel badly about their parenting because we're hard enough.
Inadequate. Like, we get it.
We do that to ourselves, right? We do that enough ourselves. So there's no one from the outside that needs to add to that.
Yes. So you guys used to be located you said you started kind of in the Macon County Health Department.
So
way back when.
Right. That we had some programming there.
Okay.
We were at Rolling Prairie Library System.
Yeah. I kind of remember that.
Yeah. So and then we kind of moved around a bit.
Okay.
So we landed most recently on Lakeshore Drive.
Yeah. Okay.
So we had 4 locations at Lakeshore Drive. Then our Early Head Start center base.
Oh, that's right.
Yeah.
Was over on Wood Street?
Now I'm not remembering. It's right down the street from the DMH thrift shop.
Yeah. Yep.
And so that's where our center was located. And then for many years we were at Central Christian Church, and that's where I spent most of my time before I went into administration. And we did our family literacy program there. We did our early intervention program there. So that's the program where children who are under 3 who have developmental delays, then they get therapies. Okay. That's where they can get therapies. So we've had a long time relationship with Central Christian and very grateful, thankful for that. The other place that we were located was Wabash Crossing in one of the apartments. They allowed us to use that. And that was really, again, one of our critical concepts that we think about is going where families are
Sure.
and honoring that space, not expecting families to come to us.
Right,
Here we are, you
right.
come to us, and
Yeah.
we'll give you all the things. That's not how.
It's not how it works.
It's not how it works. It's
Right.
not- So for we had our home visiting program in that space, which that was great. And
Yeah.
then when we were gifted the building by the Howard G. Buffett Foundation a few years ago, then now we're under one roof.
Everybody's there.
Yes.
Okay.
So we have about 85 employees.
Yeah, that's more employees than I thought. I
Right.
think that's a pretty big employer for Baby Talk. So what are all kind of the responsibilities that are covered?
So we do newborn encounters, right? So go to the hospitals to see all the babies. We do that 5 days a week. We also do, so our programming is, we think about it universally for all families. And then we have more programs that are more intentional for families who maybe are more vulnerable or who are looking for specific resources.
Sure.
So Baby Talk Times is at the library or New Life Pregnancy Center, and that's a small family child group, pretty informal, that parents and kiddos can go to.
Sure. Play together.
Read stories, sing songs,
Yep.
and then the parents can connect.
Yeah.
So we do home visiting, and that's going into the home, as that sounds, but really coming alongside parents and thinking with them about what the goals are for their family. All of our programs that we have children enrolled, like we say enrolled.
Yeah.
We do developmental screenings on all the kiddos, vision, hearing, dental. We really want to make sure that we offer a pretty solid
and that's
foundation.
I mean, that's a lot of running around that parents have to do anyways, getting all of these items taken care of or checked off to go to daycare or school. That is it's a lot to manage.
It really is.
And so to have that, have a facility that you can get all that done for people in one spot and facilitate, that's awesome.
And you're right. There's a lot of hoops to jump through, and if you're not familiar with those systems, then it's you hit a brick wall, or
like if my parents didn't have a primary care physician, I wouldn't have one, and
right.
You probably call 5 and they're not even accepting new patients, and you know what I mean, just like that whole thing.
Absolutely.
So
we have that kind of basic need. We want kiddos to be in families that have responsive relationships, and we also want them to make sure that this community has connected with resources in this community.
Yeah. So what community partnerships do you have through Baby Talk? Like, what are some of the primary organizations or places you work with to provide these services?
Crossing Healthcare for sure.
Yeah.
And we're on the same campus.
Yeah.
So that's really helpful with that. Northeast Community Fund. It's really nice to have those kinds of relationships, and we go back and forth as far as, we might have formula, they would have other food, or diapers, and all of that.
Yeah, and how nice it is to be all together.
All together.
Yep,
it's great.
What's your favorite memory from Baby Talk from your years? Or success story, or memory.
So I was in. I have of course a few.
Okay.
But there was when I was in family literacy, there was a mom who was 18 who had didn't finish high school and had a little guy who was about 1, and her mom had recently passed away, and so she was trying to get everything together. So she was enrolled in our family literacy. So she was working on her GED, and her little guy came as well. And so we really connected. And So I was her home visitor or her family support specialist. That's what we call it. So, and he struggled in school. And then she later had a little girl. And so she did get her GED. So that was really exciting. Then when her little girl was probably in first grade and she was out of the program, she called me and said, hey, Cindy, I just had my parent-teacher conference, and she's not reading like she should be reading. What do you think I should do? And we had some books that sometimes we got donations of books, and they aren't the right age because we're birth to 3.
Sure,
and I said, oh, you know what? We have some really great books for a first grader. So got those to her. And anyway, now her son graduated from high school, and she is a CNA, and just doing great. And I smile when I think about her.
Yeah, that you had such an impact that she would call you even after she's out of the program.
Right.
I mean,
And we're Facebook friends now.
Yeah. So you get to catch up. Isn't that the great thing about Facebook?
It is.
I know.
It is.
I know. How touching.
Right.
Let's see.
So I didn't tell you about, so we also have a center.
Okay. Yeah.
So we have a center, and so we serve about 80 families in our full day center.
Okay.
And that's through early Head Start funding. So it's like Anna Waters Head Start, only for prenatal to 3.
Okay.
And then the early intervention. So kiddos with a delay that qualify for therapies. And then the family literacy. So it's GED. We have a program in the morning for moms who are working on their GED. And then in the afternoon, it's through the Regional Office of Education.
Okay.
That provides 4 credit classes for those who want to graduate from high school.
Okay.
So again, those are other good community collaborators.
Sure.
Is Richland Community College and Macon Pyatt Regional Office.
Yeah, getting the GED work put together. Are you at capacity for any of your programs?
All of them.
All of them?
All of them.
Yeah. You have waiting lists for
All
people
of
wanting
them.
to get in?
Yeah, all of them.
Yeah.
It's really hard.
So like for kids with early intervention for kids with developmental delays, what other programs are Decatur that are fulfilling that need?
So the way to access those services is Child and Family Connections. And that you can just Google Child and Family Connections. And you go through that process where you get evaluated, and then you see what percentage of delay or how kiddos do on that developmental screening, and then decide, is this a physical therapy? Is it occupational therapy? Is it developmental? Is it speech? And then they have kind of a case manager there.
Sure.
So that's the mechanism to get into that.
What is the reason for being at capacity? Is it space, or is it workers, or a multitude of things?
A multitude of things.
Yeah.
I would say it's space, and just there's really a tremendous need.
Yeah.
Right. There's and that's as far as childcare goes, especially childcare, that the child education piece of it.
Yeah.
The nation is really lacking in
just
that.
Kind of behind.
Yes.
Yeah.
We have more spaces open for the home visiting or the personal visits kind of program.
Yeah.
But I think people are really wanting a space for their kiddos to be every day, to learn, and plus so they can work.
Yep. It's lacking. We see it in business with hiring
absolutely.
staff. Like that's one of the biggest obstacles in hiring staff is childcare, working around childcare, what limited childcare there is. So
I'm on quite a few state groups, Illinois Early Learning Council, and so that childcare and staffing and workforce compensation are all parts of that conversation.
Yeah.
So I think at state levels that's being discussed more, which is good. Which is good. But then you also need a facility.
Yeah, right. Yep.
So when we were looking for a facility before the new building, one of our funding streams through the Illinois State Board of Ed, we needed to be in a licensed facility. And we had the one for early Head Start, but we needed more. And it was a real challenge.
Yeah. Yep. So your space now is huge. First of all,
it's beautiful.
It's so big and so nice.
Yes.
How many years have you been there?
2.
Gosh.
2.
Yeah.
And it was built during the pandemic.
Yeah.
But it all worked.
Yes,
it was fine.
good.
It was all fine. I guess it was large enough that everybody could be there in social distance.
Yeah, that's what a blessing, right? How is Baby Talk funded?
Quite a few different ways. Our largest funders is our federal grant through Early Head Start.
Okay. Mm-hmm.
And then the next is Illinois State Board of Ed Prevention Initiative. And then we have like a Secretary of State Family Literacy. And then we just scratch our way through and get. So that's great. We have the larger grants to help with programming. Yeah. Challenges are really the overhead piece. It's really hard. The grants don't cover enough of that.
Sure.
And nobody really wants to pay for Ameren, right? Not even me.
I would prefer not to. Personally, I just did this week, and it was not.
It's a
bad day.
It's an ouch, right? But as far as funding goes, some of those overhead costs really are not covered by those the funding
the
streams.
Grant stuff. Yeah.
Yeah. So so we always are looking for funding for, we call it unrestricted funds.
Yeah.
So we have more flexibility in how those are used.
Sure. Yep. I do remember when Baby Talk was our charity of the year, how grateful you guys were that we gave funds, however little it was.
It was great.
But it was unrestricted, and I think sometimes as business donors or whatever, you don't necessarily think about how impactful that is, even though it's maybe not as like much actual money. It's how you guys can spend it is impactful.
And people really enjoy, I'd love to give money for books to kids, right? That's so heartwarming versus Ameren, right?
Yeah.
Sorry, Ameren, I don't mean to be.
Yes.
I utilities.
understand.
I'll say utilities.
Yes.
Ameren's great.
Yeah.
We'd be sad without them.
Yes. Yes.
So yeah, the whole unrestricted is really helpful. And in talking to other nonprofits around the city, that is absolutely the case.
Yeah, for everybody. That
Right.
You're not unique in that.
No.
Yeah.
No.
Do you guys have volunteers?
We are starting again. We are starting
So
again.
what do you have volunteers come in for?
Regular volunteers need to go through a DCFS background kind of check. So we do some classroom. Again, you have to go through the background check. But then we also have volunteers to do things like put strollers together, putting cabinets and toys together, those kinds of things.
Yep. Do you take donations of items?
We're limiting that.
Okay.
Again, COVID put a kind of squash on that. We do somewhat.
Okay. Some item. Is it based on item or based on need or?
And sometimes it's based on how much storage we have.
Yeah. Yeah. I mean,
so it's best to call and find out. And we don't have a lot of storage. So someone says, I have a crib. And that happened probably 3 months ago. Someone called and said, hey, I have a crib and a changing table. It's like, we really don't. And then I asked staff and somebody said, so-and-so just moved and they need all that. And so we were able to.
Maybe you can connect.
And we connected with, so that really felt nice. It felt like it was really supposed to be within 24 hours. We had it connected from a donor to a family.
Yeah, that's nice.
That was really.
Yeah. So what do you think Baby Talk means to the community?
Oh, that's a nice question.
Yeah.
What does Baby Talk mean to the community? I think it provides a nice and important base, a foundation for families and kiddos birth to 3 and really thinking about how they're starting off. We know that, we think about their social emotional development and being prepared for school. And really it's about their social emotional development in being comfortable and all the being able to hold a book, read a book, sit on some attention, and really understanding how to have a relationship with someone. And so we think about too, even just having routines. We think, okay, but if a baby knows when their next bottle is coming, know when nap time is coming, then they don't have to manage that in their little life. They can have time to be curious and play. So really thinking about that with and education, right? And there's parenting and all of that.
Yeah. I had one. How has, in birth to 3 years old, how has science maybe not changed, but what we know scientifically or biologically about children and their brain development, how has that changed over your time at Baby Talk,
wow. We've just learned so much about brain development and experiences that kiddos have. And every experience a child has, a baby, infant, it really helps form these brain connections between the cells. And there's all these cells, and how we're created is that there's billions and billions of brain cells, but we don't use all of them. And the ones that we don't use go away, and that's okay. But we really want those brain cells to connect about relationships and feeling safe and not being on guard and enjoying being able to play and learn. So I think those are some things that I learned also over the years, is the idea of how adverse childhood experiences impact. So those are some stressors that happen, and some are normal stressors of day-to-day life. But kiddos that have a lot of heavy stress over and over and over and over, and that's their norm, to have these big stressors, then that impacts their brain development. But the really cool thing about that is that what helps that, or what mitigates that, is relationships. So you can have maybe a fire in your house, but if you're in a relationship with, you have a mom, dad, caregiver who
trust, security, I guess, probably.
Absolutely.
Right.
Absolutely. So that's why it's really the importance of supporting parents with their stress levels is important, because if you're stressed out as a parent, you have to dig deep to kind of buffer your child from that.
Jill Reedy gave a presentation on, and just like the images of a brain, of a brain that has dealt with pretty consistent trauma versus one that has not, it's a physical difference in a brain that you can see on paper.
It's really remarkable.
Yeah.
And children who go through adverse childhood experiences, there's a survey that you take, and by 18 or as an adult, and the results, the research shows that those high numbers of trauma, it's, as an adult, it's like high blood pressure, diabetes, and you think, okay, of course there's going to be depression and anxiety and maybe more prone to substance use. But there's a real physical difference.
Yeah, more actual physical health issues.
Medical. Yes.
So, Baby Talk National.
Okay.
So what's Baby Talk National?
Baby Talk National. So, Baby Talk began in Decatur 36 and a half years ago. And pretty early on, we got recognition or noticed for what we were doing as far as parent-child relationship, parent is the expert, all of that. And so now Baby Talk has been replicated in 12 states.
Wow,
Yeah, 12 states. Isn't that exciting?
Yes.
So places like San Diego, Arizona, Washington State, Alabama.
So do you guys go and train?
Well, we used to.
Yeah, I know.
We did. I used to be on the training faculty. And so we would go to Chicago a lot because we have a pretty big, pretty large programs in Illinois.
Okay, yeah.
Because through Illinois State Board of Ed, Early Childhood Block Grant, Baby Talk is a choice in approach curriculum program. So we would go back in the day. We would do 3 or 4 day trainings in Chicago. So I would do that quite, 3 or 4 times a year.
Yeah.
And plus, we would bring folks to Decatur.
Yeah.
To do it, which was nice for the city of Decatur too.
Yeah.
It's not a huge impact.
Yeah.
But we'd have 20 people, 25 people here for a week.
Yeah.
Staying in the hotels and getting to know Decatur.
Yeah.
We always felt really excited about showing off Decatur.
I would be proud about that.
Yeah.
So do you have plans to grow that back or to get back out? I mean, how will that resume?
Virtually, yeah. So we were all set to go to San Diego. We were all chomping at the bit and raising our hands. We'll go train in San Diego, right? And then COVID hit. Before COVID, we have a Chicago office of Baby Talk. So we were pretty familiar with Zoom. And so we were, that was an advantage for us that we didn't have as big a learning curve. It was a learning curve, but not as big of learning. At least we knew what Zoom was.
Sure.
So because of COVID, we learned how to do trainings virtually.
Okay.
And we also started a train the trainer model. So for instance, in San Diego, they have a Baby Talk trainer, and then we help them teach them how to train their own staff.
Sure. Yeah.
And then they give us a little kickback for that.
Yeah. Cool.
Yeah. So we're really excited. Yes, we are. We want to expand that more. So we want to do, of course, Illinois and other in other states as well.
How do you get the word out about it?
There are different funding streams and there's different. So, for instance, there's a model called Healthy Families America, and they need a curriculum. So we're a good match with them.
Yeah.
So that's. We're also doing some advocacy and legislative kinds of talk.
Sure.
So we're trying to gear up on that.
I feel like that's such an important piece of a lot of nonprofit organizations that sometimes is missing just because of the lack of resources.
Oh, it's so true.
But it's necessary.
It's very
to
necessary.
get what you need.
Yes. So many of the models that are being used, family engagement models, have research projects that have been done. And Baby Talk has had research, and we've done that. So we're evidence-based. But, however, there is a national, if you will, at home visiting evidence-based list.
Okay.
To get on that is you jump. It's a lot of hoops.
Yeah, sure.
And multiple research projects, which are a lot of money.
Yeah.
And for a homegrown project, that's been a challenge.
Yeah.
So we would like to get on that.
Sure. Yep.
One really fun, one program I'm really impressed with that we work with is in the city of Chicago. It's called Refugee One, and it's an immigrant and refugee resettlement agency.
That's really cool.
And yeah, it's really cool. And Baby Talk works very well there because we honor the parents' expertise.
Yeah.
And very culturally sensitive. And so we understand every family operates individually.
Sure.
So we do that with every family.
Yeah, right.
Though when you think about it as a refugee or immigrant, then that really plays in.
Right.
And our model also is aligned with mental health practices. So we have information that on, for instance, child development, but we're not going to advise you how to toilet train your baby.
Yeah,
you know your baby.
right.
So we talk through, so what have you tried? Oh, okay.
Yeah. I think that's a misconception that I certainly have had before. I don't think that I have this anymore because I'm familiar enough with baby talk and kind of how you guys have operated. But I think it's easy to assume or think that like there's these agencies out here like Baby Talk that are telling people, here's the checklist of things you should have, or here's the checklist of things you should do. And a checklist isn't inclusive of every family.
Well, and it doesn't it's not holistic.
No.
And that's a challenge too for our providers.
Yeah.
So when I was doing family literacy, I had a passion that every mom who walked in the door should get their GED or finish. And you can read the literature and know that that's everybody need. I mean, your family's going to be better off if you have an education.
Yeah.
Well, sometimes the time isn't right.
Right. Exactly.
And I had to put that aside to say, oh, I'm looking at this family and this is going on in this family's life. And today's not, this time isn't right for them.
Right. Yeah.
But the door's open.
Yep.
So that's, I think, sets us apart as well.
Absolutely.
In that, we're not going to tell you how
Yeah.
or give you advice on how to do you and your family.
Right.
We have information, okay. And we might even say, the experts say, this is how you do it. What do you think?
Yeah.
How might that work for you?
Right. Yep.
And they'll say, oh, that's a crazy idea.
Yeah. Don't like that one. Yeah. I do think it's important for people to know that it is truly, not trying to tell a family what to do. It's coming alongside and just being the support.
So I think that's why we've had a lot of positive outcomes at Refugee One.
Yeah, absolutely.
There's a video on our website interviewing one of the moms and the home visitor, or two moms and a home visitor at Refugee One. And we've gotten some hits from our briefs that have been done about baby talk from like the Migrant Policy Institute, National Home Visiting Resource Center, about baby talk and our impact with that population. So I feel like if we can have impacts with that population that has a lot of things going on, then we have some real success.
Yeah, that's a good accomplishment. It's a great accomplishment. I like that. Okay. Well, you're having an event. You're working on an event.
Working on an event.
Okay. What is it?
Well,
What details can you share?
We are just, the ink is wet. We don't have a date. We're wanting it in June. Okay. It's in June, in person.
Okay. So you used to have your backyard barbecue.
Yes. So
that was fun.
That was really fun.
That was a good one. That used to be like the baby talk event of the year.
So the seafood boil. So we're working on a venue now, but the idea would be to bring that back, the seafood boil.
Yeah. Okay.
So again, we're working on a venue. Okay. We are it's really fresh. Okay. But there's going to be one. Okay. And we're looking for sponsors.
And it's in person and sponsors.
And if anybody, so silent auction, all of that.
All right. That's good.
Yeah, we're excited.
We'll get to that in a second. So 31 years at Baby Talk.
Yes.
Is winding down now for you.
It is.
What's your plan?
So I'm going to retire at the end of June. Okay. So very bittersweet. So
you're going to have the event and then.
Yeah. So I'm not sure what's going to happen next. Just spend more time with family. Both our kids are out of state. So we'll, I'm sure, travel to see them. My parents live near Peoria still. And so I really do want to spend more time with family.
Yeah.
And I'm sure I will do something. My husband will want me to do something, and I will need to do something.
Yes. Not substitute teaching.
Not substitute teaching.
We've established that.
No, thank you. So I know I need to still go and do. During COVID, I went to the office every day. I went to the office every day, and I was able to do that.
Yeah.
And
so you need something.
Yeah. So I'm not sure what that is.
To be determined.
To be determined.
Enough people know you and know what great work you do. I bet you'll have offers. I just feel like you'll have offers.
We will see.
So how do people find Baby Talk? How do people get a hold of you guys? Where can we get to know you better?
Absolutely. We have Facebook page. And we actually have two because we have one for professionals.
Oh, okay.
So our network of professionals, we have one for, and that's the Baby Talk Professional Association, BTPA, our network. But the one that probably would be most folks would really think about is our Baby Talk Facebook page. Okay. And we have a website.
Okay.
Babytalk.org.
Babytalk.org? Okay. For sponsors, people that might want to sponsor...
Yes. They can email. We have a new director of development and communications, and Kate Lacey is her name.
Okay.
And she has started a couple weeks ago. She is moving to Decatur.
Okay.
So she'll be here in a couple weeks, but she is. So I'm not sure of her email. I think it's kate@babytalk.org.
Okay.
Kate
so we can email
or Cindy at babytalk.
Or Cindy at babytalk.org for sponsorship information.
Yes.
Okay. Is there anything else you want people to know?
I think we're good. Thank you so much, Jes.
Yes, thanks
for this opportunity.
Yeah, thanks for joining us and for enlightening about Baby Talk.
Thank you.
And all they do.
Thank you.
C'est très jeune membre.
Thank you for joining us. Make sure to like and subscribe on whatever platform you're listening. And be sure to follow us for more content on our social media channels at Decatur Earth Mover Credit Union.